Dr. Abe Malkin, board-certified family physician. Dr. Malkin, great to have you here with us today. The CDC says that the cloth face coverings recommended are not surgical or N95 masks. So what are some guidelines for maybe making your own cloth face coverings at home?
Sure, and I think people are getting creative, due to the shortages of PPE and masks that are available. But essentially, what you would want to do is to take a scarf or a short or something and fold it over multiple times. Fold it in half once, and then take that and fold that over again to have at least four layers essentially of protection. And then take a rubber band on both sides, attach that to your ears. So you've now created as good of a seal as you can on your own. Again, these masks are not as foolproof as N95 masks that block 95% of particulates, but they'll at least block larger particles that are airborne, when people sneeze or cough, which is, one way in particular that this virus spreads.
That layering is good advice. That's good to note. But when exactly does the general public need to be wearing cloth face coverings in those situations where you can't really social distance?
Sure. I think this is something we really should get comfortable with, the idea of wearing face masks. It's something that's been common practice in Asian countries for quite a while now. But, as we, have done a good job of flattening the curve in the first couple months of this is something that we're going to need to really do for the next several months to prevent a resurgence. Certainly for people going outside, going to stores where they're around other people, face masks are vitally important. And even around others in your own home who may be out there, seeing people in the community, we don't want to be passing it in our homes, outside, or really anywhere where we're socially interacting with others.
Yet to that point, there is some thought that this might just be the new normal, even for us here in the US. But how long should the general public expect to have to maybe wear face masks in public to try to slow the spread of this virus?
Good question. We saw the virus, really surge in around February, March timeframe, and now we're kind of seeing it leveling off. And the level off may continue over the summer, but really come winter season, November, December time, we very likely will see a resurgence of this virus. So people can expect, the idea of wearing masks, especially in social settings, to continue well beyond the summer into the winter and likely into the following spring until we finally get a vaccine widely distributed.
And according to the CDC, surgical and N95 masks are meant to be reserved for medical first responders. But what are the difference between these masks and why should we leave it to those individuals?
Good question. The difference mainly involves the amount of particles that the mask can block from entering your respiratory system. So a simple face mask has multiple layers of protection on the mask itself, but it doesn't provide a definitive seal around your nose or your oral cavity. Whereas an N95 mask is much more fitted and can block up to 95% of particles that are airborne. So for those of us that are outside in the general community where there's not a high concentration of infected individuals, scarf masks or makeshift masks may be adequate. But for those that are working in hospital settings where they're coming into contact with multiple patients in a small confined area, that's where you need the higher level masks to really block as many of the particles, both large particles and small particles that may be airborne.
Have you yourself experienced any difficulty accessing that adequate PPE when you make coronavirus-related house visits?
Certainly, and it's extremely important for us because we're going into a patient's home. There might be multiple infected individuals. There might be virus particles on surfaces. We don't have the ability to sanitize before we go into the home. So for myself and my nurses who do house calls, protective equipment is vitally important. We've had to resort to buying masks from China where they're called KN95 masks as opposed to N95 masks made here in the US. Obviously, companies have been raising prices due to the shortage on protective equipment. It's unfortunate that we weren't quite prepared early on, but we're really hoping that if this virus does have a resurgence in the wintertime, we'll be better prepared at that point.
All right, Dr. Malkin, thank you so much for that advice and for your time. That's Dr. Abe Malkin, board certified family physician.